not come down, you have children, you got to come down. Some of the classics of the children's genre are here on display, original editions. I was here last week. It's a pretty cool place. Hope people get a chance to see it. I know that media is here to talk about the announcement that the governor made today in regards to Erie County, along with Monroe and Onondaga County, being designated yellow cluster zones as it pertains to the COVID-19 outbreak in the three counties. I worked a lot of hours this weekend with the governor's staff and others as we examined the information that we had, where cases were occurring, and came to the conclusion that the micro-cluster on a neighborhood level or a census tract would not work, because we were seeing, as I've said for the last couple of weeks now, general community spread. And therefore, yellow zones will be in effect, technically effective immediately, for communities from the northern edge of Erie County to some of its most well-known southern suburbs. These include the town of Grand Island, the town of Tonawanda, the city of Tonawanda, the town of Amherst, which also includes the village of Williamsville, and all these villages that are included in these towns, the town of Clarence, the town of Lancaster, the town of Elma, the town of Aurora, the town of Orchard Park, the town of Hamburg, the city of Buffalo, the city of Lackawanna, the town of West Seneca, and the town of Cheektowaga. I think I got them all. What this means is that we have been given a reprieve. We have an opportunity to prevent shutdowns. I've been talking about this for a while. A lot of people are like, you just want to shut down everything, and the answer is no. We do not want to shut down things. We do not want to shut down this beautiful library and this wonderful exhibit that is now here. We want to give everyone an opportunity to enjoy what our community has. But we cannot do that if we continue to see these rises in COVID-19 cases, especially at an exponential rate, where in a very short period of time they've been doubling. Yesterday we announced that the most recent batch of cases for November 7th came in at a 6.3 testing rate countywide. And there is no one particular outbreak that is driving it. It is just general community spread. What does the yellow zone cluster mean? It means you can still have gatherings, but no larger than 25 people. It means that you can still go to church, synagogue, any other location, houses of worship, but no more than 50% capacity. Bars and restaurants can still be open, but they cannot have tables greater than 4 per person, indoors and outdoors, and all bars and restaurants have to close at midnight. So the bars that are open till 4 o'clock in the morning, those cannot be open till 4 o'clock in the morning. Most bars and restaurants are closed by 11 o'clock. But there are a lot, including the party bars, where we've seen issues in the past, that often don't get busy until 11 o'clock at night. They have to close at midnight. Schools can still stay in-person session. However, the school districts are going to be required to do testing of their staff as well as their students who attend in-person testing for at least 20% of the total population of the school on a weekly basis. The school will be responsible for the testing. There's going to be lots more information that's going to be coming out on that soon. Talking with the governor's staff, the governor's office, New York State Department of Health will be providing what are called the Binax test kits. They're a little different than the test kits we've used in the past. The schools will be responsible to actually perform the testing, and then the report results have to be provided to the Erie County Department of Health, in which the Erie County Department of Health will then confirm with the patients in the school the positive cases and provide that information to New York State to be inputted into the New York State eClair system. People have asked since this announcement was made, does this mean closure of businesses? And the answer is no. Businesses can stay open. If we go into the orange zone, then non-essential businesses will be required to close, which includes barbershops, beauty parlors, gyms, movie theaters, which just reopened. We do not want to go into the orange zone. We are in the yellow zone for the vast majority of Erie County. I think we looked at it, and it's over 700,000 in population live in the area that is affected by what has really been a further outbreak of COVID-19. We announced earlier this morning the increasing caseload in hospitals in Western New York and Erie County. There were, if my memory is correct, there were 73 individuals that are COVID-19 positive in Erie County hospitals as of 2 days ago, because the report came yesterday for the day before. I believe 21 of them are in the ICU. Unfortunately, 2 patients died on November 7th. And we've seen, unfortunately, over the last week, multiple deaths and days, and it's really distressing because we've done such a good job of managing it, and now we're seeing the cases increase, we're seeing the hospitalizations increase, and unfortunately, we're seeing the deaths increase. We are in the yellow zone. It's a warning. We all know yellow means yield if you're driving down the road. Well, we have to yield in our practices if we are going out there and acting like coronavirus and COVID-19 is no longer an issue. We have an opportunity as a community to get out of it without having to shut down businesses. None of us want to shut down businesses. I certainly don't. I've been talking about it for a few days. Working with the state, we've come up with a plan which we think is appropriate for our region. I'll put this out here now. If it gets worse, I'm expecting us to be moved into an orange zone. If it gets really bad, I'm expecting us to go to a red zone, which is basically shut down of everything again. None of us want to see that. Our Department of Health doesn't want to see that. New York State doesn't want to see that. So let's do what we can to ensure that doesn't happen. A couple other things. New York State has given me assurance that they will assign additional state liquor authority as well as Department of Agriculture inspectors to help us as we do our review of bars, restaurants, but also supermarket and big box stores. We've been getting a lot of reports about supermarkets and big box stores having basically, it's back to the usual thing where it's lots of people there. Remember what it was walking in supermarkets for a while? They had it blocked off. You had to stand in a particular location. It's not like that anymore. But we've had a lot of complaints about big box stores. Inspectors are going to be out there. The managers of those facilities, you should be aware. Who knows when they're going to come? They're not going to come at just 9 o'clock in the morning on a particular day. They're going to do surprise visits. So if they go out to a Walmart or a Super Target or something like that and they see violation of the capacity rules, they will shut the facility down. It's not going to fine them. They'll shut them down. I don't care how many people are standing in line to buy things. They're authorized to shut them down. So it's a warning to the managers. Follow the rules of capacity. If you think this is like Black Friday and you can have hundreds and hundreds of people in the store, you can't. Follow the rules and we'll be all better for it. I really ask and implore our population to take this seriously. I know a couple people who've tested positive in the last week. Friends of mine, I have not been in contact with them in a number of weeks, but I do know that some of them have tested positive. I think, and what I've heard from them is, hey, I thought we were done. We're not done. We're going to be dealing with this for quite some time, and until we can get through with it, let's do it together. Very positive news came out today about the potential for a vaccine, but even if the vaccine gets approved by the FDA in the next 2 months, it's still going to be quite some time until it could actually be distributed to the general public. So let's get through this fall together. We all want to see the Buffalo Bills continue. None of us want to see football shut down. Let's do our best as a community to continue what we've done in the past and what we did in the spring and early summer. We're no longer in summer, even though it's a beautiful day outside. We know there's going to be a lot more activity indoors, so we need people to just follow the rules and we'll be better for it. I'll go to Sandra first.
Thank you. Can you tell me a little bit more? I know you said more information is coming regarding schools and testing, but there's a lot of concern about schools being able to meet this 20% threshold, especially if there are elementary school students that need to be tested. Do you have any more information about the BINEX test and when that will be provided or any other details?
We're going to be providing information to the school districts. Let me backtrack for those who may be watching it live. The question was in regards to schools and do we have more information with regards to the testing requirements for schools. We're going to be providing much more information to the school districts in the next 24 hours. They're required on a weekly basis to do 20% tests. What has been described to us is the schools will be responsible. The state, I believe, is going to be altering the requirements to allow school nurses to actually do the tests in the school districts. The county would not be able to provide testing for 20% of all schools that would theoretically be in existence. Now, big caveat. If it is a virtual district solely, like the city of Buffalo, they are not required to test. So any district that is virtual is not required to test. It's only for in-person learning. So if 50% of the students had returned and the other 50% had not, if the student is not returning, they do not need to test those students. They just have to test 20% of the population that is in the school, which is a combination of students and staff. David.
So, just to be clear, because the concern we've heard from school superintendents is they don't have the staff to do this. They're not licensed to do the test on the property. You say that may be changing. And of course, your county health department is not going to help them. So, the one other thing I heard about was a caveat added by the Erie County Health Department, and that was that if anyone selected to be tested, the parent says, I don't want my kid tested, the kid gets kicked out of school for 2 weeks.
The question, once again, is in relation to schools. School districts don't feel that they have the ability to do the testing. We've been told by the New York State Governor's Office, they're the ones that are going to be responsible for the testing. That's how it's written. That's how it's been done elsewhere. So they are going to be responsible. They're going to have to find a way. Erie County Department of Health is here to help, but we also have to do testing for the general public. We cannot take all of our testing capability and move it solely to the school issue. We still have to test the public through our traditional PCR test as well as the rapid test for certain situations. More information will be coming. I cannot give you all the answers at this moment, David, but more information will be coming. About what?
What about that exclusive by Erie County Health Department if someone refuses to be tested?
If they're actually refused to be tested under this, they can't go into school now.
That's an Erie County thing also?
Well, I think that's the state. It's 50, if they're refusing to be tested, then because we're in the cluster zone, then that student has to go virtual. That's what I've been told. Chris?
I appreciate that you explained why entire towns are included and not neighborhoods, but can you explain a little, first of all, was that your recommendation to the governor yesterday, that entire towns be included in the zone as opposed to neighborhoods? And secondly, how is it different, understanding we're talking about community spread, how is it different than what we saw in Broome County, where it was kind of just random?
The question was it my recommendation to use entire towns rather than occasional neighborhood here and there in particular towns? The answer was yes, and the state agreed. We agreed that this is not a microcluster, this is a macro. This is large scale. This is the vast majority of the population. If we really break it down, if you looked at every place where there was a case, it's in all these major towns. It's every major neighborhood. Now, you might have a little bit of a larger cluster in a particular neighborhood, but it was everywhere. So if we had just said we're going to limit it to Eggertsville and Amherst, or the village of Hamburg, then the rest of Hamburg would have been, oh, we're fine. But if you look at the map, the rest of Hamburg is not fine because there's cases throughout the entire town of Hamburg, just like there's cases throughout the entire town of Amherst, just like there's cases throughout the entire city of Buffalo and so on. One of the things that we've noticed is there's some communities that had almost 0 cases or 1 case a week, which now have 10 to 15. So in that chart I released yesterday, that was all cases like that were 20 and above. But there were zip codes that have had very few or 0 cases recently now that have 5 or 10 or 15 or 18. So they didn't meet that threshold to be in the 20 and above, but they still have cases. So the determination was made jointly that it made sense to include the towns. And on the call was Department of Health Commissioner Howard Zucker, Gareth Rhodes, who's basically in charge from the governor's office, with Melissa DeRosa. Melissa was on the call as well. Kara Griffin, Beth Garvey, some of the highest level individuals from the governor's staff were on the call. And they all agreed that Onondaga County was a little different. I think Onondaga is going to look a little bit more like Broome when they release it because they have specific neighborhood problems. But they looked at Erie and truthfully they looked at Monroe and realized we have town and city problems and we can't just do it by a neighborhood basis.
So why is that happening?
Why is it, the question was, why is it happening? Because we're getting lots of congregation of people without masks.
Which was not what we're seeing in Syracuse or Binghamton?
I don't know why we have highest rates, but we do. I mean, maybe their people are taking it more seriously. As I announced yesterday, was it yesterday? It seems like it was 3 days ago. I was at the train station. That was yesterday. Yeah, you were there, Tim. Been a lot of work in between then. But, I mean, we're getting reports now of people testing positive who went to adult Halloween parties. And we're getting multiple people from those Halloween parties. We are aware of 2 people who admitted they went down to the Trump rally in Erie, Pennsylvania without a mask and got sick. We are aware of more enclosed, like a retirement party, which maybe they had 40 people at the retirement party, which you theoretically could with the 50 threshold, but if 1 or 2 of the people were sick, now they've gotten half the retirement party sick. So what we're seeing is just the traditional community spread, and that's why it made sense to go on a more macro basis than micro. Tim?
Can you just talk about enforcement?
I'll come to you, Ellie.
With restricted, 25 people or less, bars closing at midnight, how can the county and localities manage that kind of enforcement effort?
Having communicated with the governor as well as the governor's staff, it's incumbent upon local governments to do that with the New York State Department of Health. That's one of the New York State Department of Health and New York State Agriculture Department's help. That's one of the things I requested. As I said, we're not going to be able to manage this completely without the state's help. They did agree to provide more state liquor authority inspectors here, like they did in Broome County and like they did in Brooklyn. So I assume we're going to get an influx of SLA inspectors. We know the Department of Agriculture inspectors go to supermarkets, go to these big box stores that have market portions of it where they sell meat. They're going to go there more often as well. So we have gotten assurance from the state. It is also incumbent upon local governments. Building inspectors and police departments, if they see a bar that's open at 1 o'clock, they have to shut it, or 1 o'clock in the morning, not 1 in the afternoon, but 1 in the morning, they have to shut it down. Because our Department of Health we're going to be closed. But if they get a call to 911 from somebody saying, hey, they're partying at Joe's place, and it's 1:30, who's going to have to go out there is local law enforcement. They're going to have to shut them down. And with all due respect to local law enforcement, I don't want people to think they haven't. They have been participating. They have been part of the process of going out and working with us when we've had to shut down bars or restaurants. So I do want to thank local law enforcement because they have been part of this. But they're going to have to take a greater responsibility. Eileen.
You said something very telling that someone said to you, they thought this was over. I'm not sure where they get their information from, but how do you reinforce this? Because there was so much COVID fatigue that has set in, and if people are having family gatherings and we're on the verge of Thanksgiving, what do you tell people to get through to them? When you opened up this back in March, you told us COVID considered to be everywhere.
The question was, how do you respond to those who feel like it's over when there was COVID fatigue and so forth? As I've said multiple times, we're all in this together. We are our brothers and sisters' keeper. We have to understand that when you put on a mask, it's not just to protect yourself, it's to protect others. And I'm hopeful, and we're standing a good distance away from each other, for those who are wondering why I don't have my mask on right now. I think it's important that people understand that we have no interest in shutting things down. There's a lot of talk on social media and others out there that, oh, you just want to take control. There was a football game yesterday. I didnn't watch it until I saw the last couple plays because I was in the office. And why? Because we're working on this plan so we can still have Bills football games. My God, the last thing we want is a major outbreak that they shut down the NFL, at least in New York State. We don't want that. We want to watch our Bills win. And that requires everyone to follow the rules, everyone to understand that when we say we're all in this together, it's not only certain people based on political party or where they live are in this together. Part of the conversations I had yesterday is there are people who live in Amherst that work in Buffalo, and there's people who live in Hamburg who live in Amherst, and there's people who work in Tonawanda that live in Orchard Park. And as a result, you have to understand that you can't just say we're going to shut down one little area and that's going to solve it all when you have this greater community spread. So to the general public out there, I just ask you to please wear a mask, wash your hands, be a good citizen, Be a good representative of the city of good neighbors, the county of good neighbors. We can do this. We should not be the highest in New York State now. And the problem is because of the density of our region, where it's easier to control it in a rural area, or Broome County, which is a little bit urban, mostly rural, we have a very, very dense population here with people who cross the borders all the time. So it's not unheard of for someone who lives in Tonawanda to drive to Cheektowaga for work. Well, if they go to work in Cheektowaga and they come in contact with someone from Orchard Park, their fellow worker, who's COVID-19 positive, someone might say, is that an outbreak in Cheektowaga? No. So now you've got a case in Tonawanda, you got a case in Orchard Park, and you probably got cases in Cheektowaga. So we all need to be better. David, you have another question?
Sure,
Right?
I do.
I'll get to you.
If you don't mind.
Yeah. You go first. You can go first.
Oh, thank you, buddy. Yeah, so every statistic and study we've seen is, and I ask this question because these requirements for the schools, even though they don't have to shut down, it looks like a de facto shutdown, and it's it's highly doubtful anyone could meet the requirements. And I'm just wondering if, because every study we've seen shows that the one place COVID's not a problem being spread is in school. And
Yeah.
did you, as county officials, in your talks with the state, ever try to impress upon state officials that we don't see the spread in schools, so why are we having to test in areas where we don't have a problem, especially when you can't help them?
The question was, if we are not seeing spread generally in schools. We are seeing some new cases among students, and we're definitely seeing cases among staff. What did you do to say don't shut down the schools? And I'm going to tell you, myself, Adam Bello, and County Executive Ryan McMahon, the three county executives that were on the one call yesterday said, please don't shut down our schools, which in the orange, they would.
Right.
And there was some talk about some of our areas going orange. So we're getting a reprieve, giving us an opportunity. It's up to the schools to meet the standard. The state set the standard when they announced the cluster zone initiative that if you're in the yellow zone, you have to do 20% testing. If the school district decides they're going to go virtual, I can't control that. But the alternative was some of these areas may have totally just shut down. And we all agree, we have not seen the spread yet in schools, though we're seeing increased cases in schools, not just with students, but with teachers and other staff. So, and if there's one more thing I can add, and this is a big one that goes to Eileen's question. If you're sick, stay home. We're getting all kinds of reports of people going into work who are sick. Call 858-2929 to get tested. If you're sick, call the county, we'll test you. Too many reports of people going into work who are sick. And then they get tested and they're COVID-19 positive. How do I know that? It's happened in Erie County. It happened in our Department of Health. And that person is being severely penalized for what was really a stupid action.
So you tried, is what you're saying.
We're trying to keep the community open, including schools. And the best way to do that is to ensure that we follow the rules. If you're sick, stay home. Call 858-2929, get a test from the county. And the school districts are going to hear more information soon from the county and the New York State Department of Health, as well as the New York State Education Department, on how they need to meet the standards. They don't need to start testing people today. They're going to have to do a test within a week. So hopefully within the next couple days, we'll get information that we can provide to the school districts and how they can meet that standard on the weekly testing. Yes.
Similar question, but in relation to nursing homes, we're seeing probably, potential spread and outbreaks in the nursing homes. Is there anything more being done to protect nursing home residents?
The question was with regards to nursing homes, that we're seeing spread in nursing homes. There's anything more that's being done in nursing homes. We have seen a few cases in nursing homes, not huge. There's one nursing home that seems to have the preponderance of cases right now because it's a COVID-19 only nursing home. Talked about it yesterday. There's less of the approximately 1,150 cases that from October 31st to November 6th. We had about 90 during that period that were nursing homes. So less than 10%, less than 9% of all new cases were nursing home. That's why I'm trying to explain to everyone, it's not just nursing homes. Nursing homes have had a few new cases, but not a tremendous amount. So I should say 90, I'm talking about there were 90 patients last I saw among all the nursing homes that had tested COVID-19 positive. So it's not a huge amount, like hundreds. So the same protocols apply for nursing homes. They've got their PPE, they still have to follow. The same protocols as yesterday still apply for nursing homes today. I'm not aware of any closure of nursing homes to the general public or visitors, even though some is still not allowed any visitation at this point because we're in the yellow zone. I guarantee you if we go into orange zone, everything changes.
Could you
Any-
talk more about
Yeah.
the COVID hub, the Lincoln building? What is it? What is it?
It's not open yet. We're finishing doing construction, but we have turned what was affectionately known as the Ticor building. It's actually an old church where 3 presidents actually attended Mass there. Millard Fillmore was a member. John Quincy Adams attended Mass there, and Abraham Lincoln did. And there's a plaque on the building which notes Abraham Lincoln attending Mass there. And so we are converting what was primarily storage. It previously had been used for emergency operations and storms, and we're turning it into a COVID-19 hub for our Department of Health. Our contact tracers will be based on one floor. Our epidemiologists will be based on one floor, and our call center will be based on another floor. There's 4 floors in total. And we are basically taking our health department and we're segregating these specialties on particular floors and turning it into a COVID-19 operations center, so to speak, because we believe we're going to be dealing with this for quite some time. And then in the long run, the epidemiologists and other health department staff will be permanently housed there. You were first and then second.
Just clarify something you said yesterday at the train station, because there was a lot of talk about it and a lot of questions about it. You said we could have to say you can't have Thanksgiving gatherings except for immediate family. I don't know if you're speaking hyperbolically there, or if you meant that literally, and if so,
Well,
what authority does
the
the county have to do that?
well, I mean, if you shut down, if you go to red, if you go to red, I think you're down to 10, no more than 10 non-essential gatherings without any travel into the region. So if you got family that live in New York City or Tennessee, they couldn't even come here if you get to the red zone. We're trying to avoid that. Right now, you can have a non-essential gathering of 25 people or less. So if we stayed in this, you theoretically could have Thanksgiving dinner with folks from the region, from outside the region, but if they came from outside of New York State and they're one of those other states, they either have to quarantine for 14 days or they have to get a test done to prove that they're COVID-19 negative. And I'm just relaying information I've had conversations with the state, is we do not want to have to shut down houses of worship. We do not want to have to shut down family gatherings during Thanksgiving or Christmas or Hanukkah or Kwanzaa. But if it gets so bad, we could be exactly where we were in March and April, where everything's shut down.
But to be clear, there would be no mechanism in place for the government to tell me that I can't go to my friends for Thanksgiving dinner beyond the limit on people at that gathering.
As of right now, we would be if we got to the point like we were in the spring, then we'd be in the same situation in which we're basically on lockdown. I really don't want to see that. None of us want to see that. I think Sandra, I'll come to you.
I'm interested to know when the state will revisit the yellow zone designation that's been given to the area, and when we might know whether that zone will be changing at all, as well as, I know that you said more information is going to be coming, but in regard to gathering specimens for a test at school, I don't know many young children who can sit still for the nasal swab test, so I don't know if you have any more information.
The question is with regards to, the second question was in regards to testing in schools and children. I'm not the expert on the Binax test. I defer to others to give you that more information. Sandra, I don't know how that test is actually administered. I don't know if it's a nasal or if it's a pinprick or something like that. I'll defer to the Department of Health.
Do you know this applies to private schools also, or? just
It applies to all schools, all schools.
Okay.
And actually, I talked to the mayor this morning, or actually after the governor announced it, and I had already had the information, but agreed not to release it until the governor announced that we were in a yellow zone. And I talked to the mayor, and it's not an issue for the City of Buffalo public schools, but it is an issue for the private schools in the City of Buffalo. They are going to have to meet this standard. And your other question was regarding?
When will they revisit?
When will they revisit? Well, we're going to revisit it at least on a weekly basis, but if you look at what's happened in Broome and Brooklyn, it took them at least a month before they were able to move out of their zone. So it's going to be revisited on a weekly basis, but I don't think people should just assume that next week we're back to normal. This is a reprieve. If our numbers continue to go up, if our hospitalizations go up, our cases go up, our deaths go up, and we're not going to be going backwards, well, depending on how you look at it, we'll be going to the orange or the red, and we don't want that. We want to go back to sort of where we were beforehand. Yes?
I've got a question on the gatherings. So you can have a gathering of 25 people or less, but you're saying there's community spread happening at gatherings and still allowing fairly large gatherings. Are these under the assumption that everyone is wearing masks and standing 6 feet apart?
The question was with regards to gatherings. You can still have gatherings of 25 people or less that are non-essential under the rules. The answer is yes. And is it should you be wearing masks and standing 6 feet apart? And the answer is yes, as best as possible. We do know it's coming from community spread. I've said this all along. If I'm not going to parties or things like that, I've gotten invites like from people. Hey, we're going to have a grand little shindig, a barbecue, on Veterans Day, and I'm like, I'm going to avoid that. I've had invites people, hey, let's go watch a football game. I'm going to have 15, 20 people over in my garage. Like, I'm going to avoid that. I mean, we all want to enjoy it. I understand it more than anyone else. We all deal with it. But as of right now, we just have to be cognizant that COVID-19 is still in our community. Coronavirus is still out there. It is being shared, and the growth is being shared at a rate that just a month ago we would have said, nah, it's not going to happen, but it is. Because we knew it could happen, but we hoped it didn't. But when we were at 1% or 0.7%, and there were other areas that were like 0.2 or 0.3, we were like, wow, we're bad, we're at 1%. Well, last time we tested, we were 6.3 after a number of days of 5%, and I think the rolling average is now 4.7. That's bad, because the exponential growth in a short period of time, it's doubling. Went from 1 to 2, 2 to 4, now we're up to 6. I'd hate to see in the next couple of days we're 8, but I wouldn't be surprised based on what we're seeing. So just try to avoid all non-essential gatherings, even though technically you can do it. I think you have a question.
How are
Yeah,
you
Vanessa.
with your stock in testing kits?
We are okay with our testing kits. Our PCR testing kits, we actually have thousands, and we're receiving reagents back from the CDC on basically a biweekly basis. This is a question I thank you for bringing up, because I want to talk about rapid tests. People are like, why aren't you rapid testing everyone? We were down to 800 rapid tests as of yesterday, testing kits. We've gotten assurance from the state that they're going to give us another 1,500, which will probably get us through the next week. There is a shortage of rapid tests nationwide. New York State informed us yesterday that they're having trouble getting rapid test kits because of the demand across the nation, where there's COVID-19 everywhere now. So for those who keep on saying, why aren't you testing more people with the rapid tests, we have a limited supply. So the PCR tests, we actually have tens of thousands of the PCR test kits. So, and that's still the same. They still take the swab up your nose. I had another one last, what day was it? Friday or Saturday. And I do it every couple weeks. And I was negative. But the PCR test and the rapid test is the same. They take a nasal swab. The rapid test is just, there's the machine. They put it in the machine, and within 15 minutes, they can determine, but we have only 10 machines. And we split them across the county. The PCR tests, we can do hundreds at a time. And the state can do the same thing. So if you want to get tested, you can call 858-2929. If you're going to demand a rapid test, you're probably not going to get it, because we just don't have the supply for it. I just want to make sure no one else who hasn't asked a question.
Just real quick then.
All right, then, David.
Yeah, thank you. Sorry about that. Hey, listen, you mentioned Broome County, and what happened down there in their zone was, those schools ended up bringing in private firms to do testing because they couldn't do it. They didn't have the capacity, they didn't have the legality, and then it cost them thousands of dollars per week. I talked to a superintendent today who said, in anticipation of this, they've already looked into private testing, and they can't find anyone who'll take the business. So what do you tell them?
The question was regarding schools and doing testing. As I spoke to the state today, they are going to change their regs to allow school nurses to be able to administer the Binax test.
The Binax test is different.
It's slightly different, but I will defer to my Department of Health to provide that information. But it is not going to be the responsibility, it's the responsibility of the school district to have a test performed. But they understand it's going to be very difficult to just bring in private entities. So they're going to change the regs, because right now the school nurses can't. So the school nurses can perform the tests on staff as well as students. And then they are required to provide the results to the Erie County Department of Health, our public health lab, in which we review them, and then we put them into the system, the eClair system, so that they go statewide. Yes.
We received some information that there was an outbreak at a popular Village of Hamburg bar over Halloween, resulting in 50 people needing to quarantine. Can you confirm this and provide any more information regarding this, such as penalties or consequences, or how many people tested positive?
It was a question with regards to a bar in Hamburg where you said up to 50 people may have tested positive. I'm actually not quarantine. I'm not aware of it. If they're quarantined, that means they were probably there when someone was tested positive, but they may themselves not be positive. I'll have to defer to the Department of Health. I'm not aware of it. Contrary to what people think, I'm not aware of every place where there's a COVID-19 positive test or there's an issue. I always remind people who forget, Erie County's pretty big. It's about the same size geographically as the state of Rhode Island, and we have more population than 5 states. We actually have greater population than North Dakota, South Dakota, Alaska, Wyoming, and Vermont. And we're fairly large as a community, so at any one time, I'm not aware of what's happening, but I'll have our Department of Health look into it. Sandra?
So
And then I'll come to you.
when do you expect that inspectors will start going out to different places to enforce the new yellow zone regulations on businesses and big box stores? I know you said you're getting some assistance. I'm not 100% clear on exactly how that work is going to divide out and when businesses can expect this enforcement to begin.
Well, the question was, when should businesses expect enforcement to begin? And the answer is today. So if there are bars that are open at 2 o'clock in the morning, they should expect to get shut down, and that information will be sent to the State Liquor Authority, in which they could theoretically be penalized and have their license removed. We understand that the information has to get out to the bars and restaurants with regards to 4 per table, but we'll go out today. There will be environmental health sanitarians going out from the Department of Health. There will be staff from the State Liquor Authority. If they go and they see 6 people at a table, they'll probably give a warning to the bar. I don't imagine they're going to penalize them in the first day, but if we come 3 days from now when we see it, they're going to get written up. And actually, they went out this weekend, and they went out to a number of locations, and I know they gave a couple warnings, but they didn't give any fines because of what they saw was not egregious. Chris, did you have a question?
Some of the areas just outside the yellow zone,
Mhm.
So like Akron, Alden, Eden, Evans, stuff like that. Of course, they're not subject to these restrictions. So, if you want to have a big family dinner out at a restaurant, you can go to one in Alden in theory. I assume your message would be, don't do that?
The question was, there's areas just outside the yellow zone where people might want to go to have a dinner or picnic or a party. You shouldn't do that, and I'd say, yes, you shouldn't do that, because there are cases in those communities. I know there are cases in Akron. I know in the last week there have been cases in Evans, Eden, Colden, Springville. They're just not to the density level where it was determined we should shut those or we should enter them into the yellow zone. But if you're going to go to your favorite restaurant that happens to be outside of the cluster zone and think, hey, we can party up, remember, those restaurants and bars still have to follow certain guidelines. They can't have more than 10 per table. They have to be, I believe, at 50% capacity. They shouldn't be at 100% capacity anyway, otherwise they could be shut down. But if you think, oh, I'm going to avoid this by just going out the zone, I want to remind everybody, when we talk about community spread, it's the travel across our community that spreads it. It's somebody living in Cheektowaga who goes to Gowanda to go to see their friends and family in Gowanda. And maybe one of them has it, and then they take it and they leave it, or they take it back to where they were. So we just want people to understand it's everywhere. Just because you're part of Erie County is not in a yellow zone doesn't mean you have no cases. Or no new cases in your community. There are new cases across the whole county. They just don't rise to the level like we're seeing in some of the other areas.
If I can follow up, how did you get the state to back down on the thought of an orange zone? If I worded that question
Well,
appropriately.
it's not so, well, I think the thought was not so much the state backing down from the orange zone, is that there were particular really micro areas where you could have gone to orange. But as we were explaining to them, is like, well, the problem is it's the whole town. So maybe you got a whole lot of people in this one area here, but you look at it and you got it in the whole town too. And the city of Buffalo is also a good example. You have some areas in the city of Buffalo where you've had some really high rates just in the last week alone that you didn't see recently. One of the biggest zip codes we've been talking about for some time is 14212. If you looked at 14212 in its last week, it actually went down. It's pretty good. But I live in 14209. Boop, shot up. So, I mean, people need to understand, okay, if we had said, well, 14212 met it because it had 3 weeks in a row, but 14209, it's only its first week, that's not fair, because it would have been truthfully unfair to 14212 because its zip code's going down, while on the other ones it's going up. So and just thinking about the density of this community and realizing it was something like Brooklyn, where you had a hot spot, a red, and an orange, and then you had a big yellow. And it was like, well, we're not Brooklyn, but we do need a big yellow, because it's not one area that's driving it. In Brooklyn, they had some specific locations, especially associated with a Hasidic synagogue, where they realized there was tremendous spread from that location, and a lot of people lived around it. We didn't necessarily have that here. We have a lot more cases that just happens to be across the whole region. So when we talked, it went from not a micro cluster to a macro cluster. That the same principle can apply, but we're not going to eliminate it by focusing on one neighborhood. We're not going to eliminate it by focusing on one town. If you said we're going to put Orchard Park in a yellow, but not Hamburg, and they abut each other, and they both had high numbers, you wouldn't really have accomplished much. So it made sense to do it on a more macro level. One more question, if there are any. Yes, last question.
How soon are we on track to enter the orange zone if these trends continue? And how confident are you that these yellow zone restrictions will prevent that?
Well, here's what I'm asking the public to take this seriously. The question was, how are we on track for an orange zone? And the answer is, I don't know. But this should be a warning to our public, to our business owners, to the rest of the people out there. And if I failed to say this, shame on me, because I meant to say it. We've basically been given a reprieve where we're not shutting down businesses, where we're not going 100% virtual schooling. We have an opportunity as a community to work our way out of this problem by not getting worse. I expect to see another day or two of high numbers. What I want to see is a week from now, the numbers starting to go down, because people have now taken this seriously and realize, yeah, I'm going to wear the mask wherever I go, anywhere out, and I'm also going to be much more cognizant about maybe not going to that party at my friend's house in the backyard where there's 30 people. So this is our opportunity to avoid the orange and red. This is our opportunity to say as a community, we can and will do better. We must do better. We do not want to shut down our local businesses. We want people to shop at our local businesses. We do not want to shut down local establishments. We want people to go to these local establishments. And we have an opportunity to do that. I'm hopeful that we're never talking about a particular community going into the orange or red zone. I'm hopeful this is as bad as it gets. But I'm also a realist. And if we don't follow the rules and we continue to see growth, it's only inevitable that we go to the orange or red. So let's do all that we can to stay at a level where this is as bad as it gets, and then we can go back to what would be considered more normalcy. Thank you, and as I said, if there are particular questions that are more appropriately directed to the Department of Health, I ask that you reach out to the Department of Health Public Information Officer, Kara Kane. She can certainly give more information with Dr. Burstein on the Binax testing strips, or testing kits.
You know how to spell that?
I think it's Binax. And we do actually have some. We've received some from New York State. I don't have the exact number of Binax tests we have, but we do have some. Please direct those questions to the good doctor. Thanks, everyone.